Is what are things to look for a comprehensive autism evaluation? And this really depends upon the age group of the individual being assessed. For younger children, I would definitely look at a developmental scale, as well as an in-person, if it can be navigated, autism assessment that really looks at your child's strengths and weaknesses. There will always be some rating scales, but rating scales are not a perfect measure. Sometimes you have parents that complete the rating scale and they are so anxious that they select a lot of things. And then sometimes you have the reverse, where you have a parent who may not see some of the things going on that may be of concern because they just see their child that they love so much and they just see it as it being part of them and ingrained in them. And so it's really important to have a trained eye kind of looking at and seeing what we see in the range of developmentally typical versus atypical for that child. So some other important things I would look at for older adults may be where their adaptive functioning skills are. So does their cognitive ability or their IQ match kind of where their life skills and daily living skills are at? Social skills are an important thing to look at. So how do they relate to others socially? Are they engaging in socially motivating interactions? Are they doing that in a socially appropriate way? Are they able to make and maintain relationships in an age appropriate way? Other things that people might look at during an evaluation might be a sensory component, because sensory does impact a lot of individuals on the spectrum. So something like doing the MIGDIS interview incorporates into the evaluation and interview sensory components towards that. And ADOS will give an individual the opportunity to kind of interact in a variety of ways to see if the evaluator can kind of draw out and look at some of the symptoms of autism kind of indirectly. So all of those are important to consider when diagnosing somebody on the spectrum. And then when you go into adult diagnosis, which is the next question, how do you get evaluated as an adult? This would include a little bit more of looking at the whole picture of everything going on, both mental health wise, medical wise. Every evaluation you want to consider kind of the whole picture, but adults, there it is a little bit harder to kind of tease out some of the symptoms from adults than it is for children. Oftentimes there are a lot more co-occurring conditions for adults that we need to look at in a lens of, is this happening in addition to, or is this happening instead of?